Thanks very much. It's been a great couple of days so far of listening to presentations, and I'm really thankful that such rich information has been brought and shared with us as a group. One thing I found in life, you can know a very little about a lot of things. In my case, you know a lot about very little, and that's my motto in life. You can either be, good at one thing, or you could be average at a lot of things. So when I give this presentation in examples, I'll play to my strengths, and that's, I guess, the time I've spent in sterilisation, disinfection, and those disciplines. Before that, I was a hospital engineer, so that will be the basis of the examples I give. And one of these buttons is the go button. Excellent. We work within these really critical environments, and it's interesting that more and more I'm being taken away from doing design and calculation work and working out the math behind the reprocessing environments of our hospital, and spending more time in hospitals all over Australia trying to get them back out of an emergency situation. They're in a code yellow, there's contamination, there's a failure, there's all sorts of issues within these spaces because they're becoming so complex. And my time is being diverted there away from actually designing new facilities or redesigning facilities. And the environments we work in are becoming more complex. I started in health in 1987, and if you went down to the sterilising departments in those days, we had downward displacement sterilisers with huge radial arm locking doors. Most things were washed by hand. Now it progresses where we've got automated process, we've got robotics coming in, we've got some really sophisticated devices, and they're fed now with more and more high specification services. So we used to wash with whatever water we had available. I started on the Darling Downs, and the hospital in those days was mostly fed from an underground aquifer on site, not the town water. And that was actually better quality than the town water, probably still is. If anyone from Toowoomba here? Yes. Things change over time, and we've all of a sudden realised within the disciplines we have in disinfection, in particular of devices, one of the most, if not the most important factor of that is trying to get things clean. And to do that, we need really tightly controlled water supplies. Disruption of service can bring services undone. You lose the ability to reprocess, disinfect instrumentation, and all of a sudden your operating theatre at a standstill. And that's how my business started, through a phone call to say, can you come and get us back online again? Get the television cameras away from the front of the hospital, basically. That's exactly how it started. Preventive and proactive maintenance and management is essential. We can't be reactive all the time. We've got to be on the front foot with the way we do things. Some of the risks that we face are, facility damage, equipment failure, disruption in workflow and staff, biological issues as far as, when we think about infection control, sterilisation lapses, and then technology itself that occasionally brings us unstuck as well. So we've got to be thinking about lots of different aspects. Cleaning and disinfection, if we just focus on that example, it prevents healthcare associated infections. Now, one of the things that's really hard to join the dots between is infections within health facilities and where it happened. There's so many places for it to happen, and to actually go back through the pathology of it all, it's very hard to pinpoint where the breach was. So we have all these really elaborate precautions that we use in multiple stages, whether it be the instruments and their cleaning and sterilisation, or our practices and the air quality and airflow within the operating theatre intervention suites. So, but it is a massive problem, and it kills people within this country. And the numbers are actually fairly staggering when you look into it. It also protects our staff and the like. Innovation is changing things, of course. There are new technologies coming in, and you know, years ago we used to talk about UVC. Who's old enough to go to the barber and have the scissors and so forth and the little tiny UV cabinet up on the top? No one's putting their hand up. One. Boy, I am a dinosaur. It didn't do any harm whatsoever having that UVC. We've got smart sensors, so there's new technologies. UVC is one of these things that's coming in. We're starting to look at sterilisation with different medias other than steam, hydrogen peroxide, low temperature formaldehyde and steam combinations. Some of those scare us a lot sometimes when we think about some of the things that happened in the past, but the things that we need to manage going into the future. Our hospitals are wired up these days with all sorts of BMS systems, and I've worked on those in the past, and we can look into the performance of our sites. My eyesight's terrible, so I keep on doing this. Data analytics and predictive maintenance, and we saw some great examples of data analytics, some of the stuff about air quality and energy usage with the temperature curves. I love that sort of thing, and more of that data, if we identify the value of it and start using it and presenting it and sharing it, it's a great tool of really moving forward with innovation. There are some risks with innovation though. Just at the previous slide, I won't go back to it. UV disinfection, hydrogen peroxide sterilisation, they're widely used within our facilities. We see machines coming into our environments all the time. For both of those two modalities of disinfection sterilisation, there is no standard anywhere in the world yet. UV disinfection, hydrogen peroxide sterilisation. We are sort of going by research and white papers of companies who manufacture these machines. Some of the other modalities, steam sterilisation, well documented, well covered by standards. So sometimes we have to sort of go outside of our comfort zone to embrace new things, and with that comes a certain amount of risk, but we've got to show the right caution. Empowering teams for risk reduction, staff training, certification. Look, I do a lot of auditing work these days, and one of the things that I'm fearful of is that some of the knowledge that we had within our sector is slowly eroding away. Maybe it's because we're all becoming a bit more pigeonholed and specialised, and we don't have such an overarching view of things. Maybe we're so time poor because things have been so complicated for us and maybe underfunded that we don't have time now to really pour the training into our own staff. And that even goes to our subcontractors. We're so busy doing the work, there's no time to stop, think and share. And I see this as being a problem. An example of that, we'll look at in a minute actually, building a culture of safety and accountability. Multidisciplinary collaboration, rapid response to protocols of incidents. All these things we need to think about, of course. Case study examples, and look, I'll just mention a few, but we'll look at one in more detail. Measuring and monitoring of building-free chlorine levels. An example only, you know, well, I've had 3 examples at 3 different states over the last 2 weeks of this, where we have problems with high bacterial levels in our water, high plate counts, and when we look at measurements for the chlorine levels, we're looking at total chlorine and not free chlorine. The difference? Total chlorine is the chlorine that's already done something and it's collected with some contaminants, it's spent, and the free chlorine is not yet spent, it's a free agent ready to kill. Total chlorine is the two put together, but you mightn't have much free chlorine at all in a total chlorine measurement. So the disinfection value of that is next to nothing. So understanding some of these things and educating people helps us to then manage our systems. Dew point breaches and sterile stock, we saw that one from Adrian. The drips off the centre of that diffuser and the air conditioning system. Lovely, brand new building, we're dripping already. There's designs, I was getting involved in a project 3 weeks ago where a hospital has lost $400,000 in sterile stock from a dew point breach. Not a great size hospital really, a couple of 100 bed facility, $400,000 loss. That buys a lot of infrastructure. If we save some of these monies in these breaches, we can put it back in the right spot again. It all comes back to the fact that when this hospital was designed maybe 20 years ago, someone said, well, down south here we don't get much humidity, so we don't need to look at a dehumidification logic in our BMS. we can just cool it and heat it back up again. We don't have an algorithm there for dehumidification. They've got all the systems to do it, but not the algorithm of the BMS. Dew point breach, $400,000. Well, that's an expensive algorithm, isn't it? Process failures due to calibration errors. Oh, here we go. I'm getting into it now. Calibration. Who's done calibration in the room here? Anyone done calibration? Wonderful thing. Takes you a long time to get your head around calibration of all the intricacies of it. And you can see here, there's listed mistakes. I got this off a website. It was great. I feasted on this. Neglecting manufacturer guidance, skipping zero and span calibration, factors when you're doing calibrations. Number 8 I've put around. Ignoring the instrument's error curve. When I'm doing audits in facilities around Australia at the moment, I am absolutely shocked when people do things like validating and testing steam sterilisers, washer disinfectors. There's this trend in the market where you can buy these really cheap data loggers. Fantastic, easy to use. You can train a person to use it in 10 minutes. Seems like the answer to everything. You don't have thermocouples and wires running around everywhere. Furthermore, where the standard says that they've got to check the calibration of that device before they do the test and after they do the test, they're not doing that. They're just sending it away, this little logger, to a test lab once a year. And here's this. I've blanked out the test lab's name. Didn't need to, because they didn't do anything wrong here. They did a calibration and they reported it correctly. Now, this logger's used for washer disinfectors and sterilisers. Washer disinfect, I'm going to disinfect at 90 degrees, steriliser 134 degrees. So to calibrate this, this logger's only got a 0 point and a span. So the middle point, you can't control it. And in this case, as left error, if you can see that, at 30 degrees, it's a 0.02, pretty good. At 135 degrees, or 0.21, not so great. At 90 degrees, 0.63 of degree error. The standard for that particular washer disinfector, 15883, if you know that standard, it says on the side here, the acceptable total error of the measurement system, the chain, is only plus or minus 0.25. This is the predominant logger system, a type of system that's being used in our Australian hospitals now. You've probably got some of these devices testing your systems, but you never see these reports too much. One of the famous coordinators of one of the standards standards groups I'm in at ISO always rolls back on his chair at a point like this and says, "This is how aeroplanes fall out of the sky." Little errors. And you transcribe that to other disciplines within the hospital, biomedical equipment, even BMS systems. If we're looking at readings that are not right, we're in no man's land. We've lost our reference point. Process standards and best practices. With calibration, you need a clear procedure to follow. If you're measuring temperature, calibrating temperature, you need to know the error on rise and error on fall. You need stabilisation times and all sorts of things. It needs to be documented and followed. There's an ISO standard for that. I'm actually working on a new work item at ISO that gives more guidance around that calibration space, so that'll be a nice document when it comes. Routine risk assessments and process audits. Somehow we've got to find the time back to go through all these things in our facilities and make sure that things are being done right, so we can save that $400,000 stock loss or whatever it might be. Incident reporting, root cause analysis. What caused this problem? And that one where we had the dew point, I asked, have we got a BMS? Yeah, we've got a BMS. Have we got trending ability? Yes, we can trend. So can you give me the flow and return temperature of your chilled water, and can you give me the percentage of the chilled water valve opening on that particular air handling unit, and then the reheat percentage as far as reheat. From that we can work out whether the chiller failed or whether the air handling unit was not performing right. I guess we could do it. Still waiting. Incident reporting, root cause analysis, unless we're getting the right data set, you'll never put your finger on the cause, and in another 6 months' time, we'll have another stock loss. Compliance with regulations, accreditation standards, I think I've covered that. There's all sorts of things coming along the line. AI is playing a really good part. Automated sterilisation and disinfection systems, a lot of those now are coming with their own AI tools that will give us heads up of when things are going outside of the parameter which we think is acceptable. There was a standout before, I won't mention the name, but they are looking at also getting into this space for the sterilisation area and all areas of I guess, our services and systems within hospitals to try and plug in some tools that save us some time and give us a heads up of when things are going to fail. Real-time monitoring, of course, secure systems, we talked about that previously. Key takeaways. Effective management, safeguards, patient safety. We've got to have the systems in place. We've got to have time to do what we need to do. We need the funds to do what we need to do. And one of the things I think is particularly powerful is that, you know, today started off, we had a presentation from one of the leaders, Deputy Director General of Infrastructure, I think it was. These are the people that we need to really communicate through to with some of our learnings. So we just think about the last 2 or 3 presentations alone, some of the outcomes from that and the savings and the improvements to the quality of the service. If we could somehow communicate every one of those back to our state and territory equivalents that look after these areas of infrastructure, sustainability and innovation, we can start a narrative which is not just a single, you know, we're going to roll out this sustainability policy, but it is information, data going back, innovation, ideas going back to them for them to incorporate in their policies, which hopefully will get a good funding allocation, and then we can, you know, bit by bit. We're not talking about changes that we can do overnight. I've been part of this organisation for over 30 years. Things have changed. Some things have improved incredibly. Some things probably have stayed the same, and maybe some things have regressed. It's hard to get change, but it takes, you know, a committed group of people to really put the shoulder to the wheel and push forward and communicate everything. And I've been particularly impressed this year at the conference of the collaboration and the papers given. I was really taken back with the New Zealand presentation. I just think that was absolutely wonderful, and the conversation even between us and New Zealand and pushing these things forward, I think, can only help. And for me, starting in this organisation as a very young man, I think it was the youngest in Queensland at the time. They used to call me Boy. G'day, Boy, how are you? I'm sort of not the boy in the room anymore, that's for sure, but there's new people coming in, there's new blood coming in. If we can really inspire them to take that message, to take that vision forward, and try and make this, you know, such a better side of things. I do fear the respect for the engineering side of health facilities has eroded. Sometimes you hear cynical conversations about engineering and support. It saddens me because you take that away and it all falls over. We've got to get out, prove ourselves and start pushing forwards, and we will find ourselves respected and well rewarded for what we do. Thank you very much.